Well, that's good stuff, man. I'm in your office and I got a chance to look around, seeing all the, all the cool stuff that you got in here. You got your degrees on the wall and all that good stuff. So tell me, where did the passion come in for you to be a psychologist?
Well, I think it was something that I was always naturally interested in doing. Hearing people's stories, learning about why they made choices in their lives. It was just always something I was naturally interested in and passionate about, getting to know people, finding out what made them click. And so I think identifying that passion early on for myself served as a roadmap for me academically and in my career choices.
I like that roadmap. All right, well, let me roadmap this next question.
Okay.
What type of tolerance do you need to be successful in this field?
Right. Well, you really have to be willing and able to get through a lot of years of hurdles. Academically, people who are pursuing a career in clinical psychology really have to work on a volunteer basis, for years in order to accrue the clinical hours and experience that it requires to get licensed as a clinical psychologist. So you have to have the time and the patience and really the passion because it's not a lucrative career, especially during the training years.
See, that's what I'm talking about. You just mentioned a couple words, the drive, the passion, but that's what keeps it going.
Absolutely. You have to, it's not something that you can feel lukewarm about. You have to truly feel passionate about
that one, lukewarm.
Exactly, about people and, fascinated by the tools of the trade.
There it is, the tools of the trade. You gotta
Therapy,
have it.
assessment, the clinical work.
Got you. How did you know you could do it?
Right. It wasn't something that I necessarily spent a lot of time focusing on. What I did was, that was my larger goal, was obviously completing, a doctorate in clinical psychology, but I really took it in small steps. It was, I'm going to complete, this year of coursework. Then I'm going to, determine, the topic of my dissertation and gather, my mentors and the people who are going to help me and work with my research. So I just really took it in small steps. It was always something that helped me, was thinking of it in small steps rather than, the looming larger years ahead of me.
Right. So the smaller steps, led you to accomplish these
Sure,
goals.
The larger goal, absolutely. But really, I think thinking of it in smaller steps was really what allowed me to just keep going and stay motivated because, I felt the reward of accomplishing those smaller goals.
Who have you worked with and what made you say, I'm in this for the long haul? Because you're like entrepreneur now.
Sure. I think early on what was helpful for me was enlisting other professionals in my field, other women of color, Latinas, African American women who were already established in the field and could impart their knowledge and their experience to me and give me guidance. And that was really what helped me realize that there will be hurdles, there will be difficult people that I would have to work with along the way, but in order for me to meet my larger goal, which is to get out, get licensed and start giving back to my own community and other diverse cultures and within my field, it was having those mentors that really helped me stay focused.
So let's talk about what are you working on now?
Okay. So currently in my practice, I see people in individual therapy, couples, families, individuals. So that's a part of my work. I also do assessment for the City and County of San Francisco. So, cognitive and personality assessments, for legal purposes. So for example, I was trained in personality and cognitive assessment. So determining people's intellectual functioning and personality functioning. And so for some people, when they're, in a legal situation, it may be to determine parenting capacity, how equipped is this person to, be successful in a parental role with regards to intellectual functioning, responsibility, emotional wherewithal, those kinds of things. And that's, something that I would do. I would give them a battery of tests and, do a thorough interview and, basically write about the themes that come up that will give a judge more information about how this person is functioning. So that's just one example.
Let's say someone out there who wants to become a psychologist, therapist, whatever. What are the steps after you get out of college?
Sure. And I get this question a lot. Parents, friends, people pursuing a second career, they ask me, I'm really interested in possibly becoming a therapist. What are the steps to take after a basic college degree, a bachelor's degree? And the first thing to do is really to look into what type of program might you be interested. Are you interested more in doing research and teaching in an academic setting, or are you interested in being a clinician, working in a hospital setting, private practice, mental health clinic? Myself, I went the clinical route, and so what you would do is you would determine what part of the country you wanted to attend graduate school. You would apply to graduate degrees in clinical psychology. You could pursue a PhD or what's called a PsyD, a doctorate in psychology. And I would say the first 2-3 years are coursework. You enlist mentors to help you plan your dissertation, and then at the same time as you're doing your academic coursework, you're also involved in clinical work. Basically supervised experiences that allow you to gain experience in providing therapy for families, individuals, children. After you obtain your degree, you pursue, actually you're required to do 3,000 clinical hours before you can get licensed. So 1,500 of those hours come in a pre-doctoral internship. Mine was at San Francisco General through UCSF. And then you obtain your graduate degree, and then you're required to accomplish an additional 1,500 hours of clinical work, a post-degree, so that's called your postdoctorate, postdoctoral residency. And I completed mine at Kaiser Oakland. And so then, from that point, you sit for your licensing exams, and then you're good to go.
That's what I'm talking about. Graduation ceremony.
Exactly. Finally, after years and years.
Exactly.
What I often get is people who I know or friends of friends will send me messages asking questions about either themselves, family members, or friends who they're concerned about with regards to their mental health or mental health issues. And so while I really enjoy responding to them, I know that, for the one person that asks that question, there are, dozens of people who don't actually ask the question, hear a response, or even know someone in the field of psychology to ask. And so what I'd like to do is start a video blog that will allow me to get that question out there and respond to it, and give people some guidelines about how to address certain mental health issues that they come across.
See, I like that.